Okay, hello again. So we're here today to give you an update on novel coronavirus in Ontario with a further update, and I'm joined by colleagues today. The middle, Dr. Barbara Yaffe. This is Dr. Chris Mackey, who's the Medical Officer of Health for the Middlesex London Health Unit. And we have Dr. Vanessa Allen, who's the lead medical microbiologist at the Public Health Laboratory at Public Health Ontario. And so what we want to tell you mostly today is that we're going to confirm our third case of novel coronavirus in Ontario. And just to say this is a little bit different than the other one, and that's why we're going to be talking to you today. This newly confirmed case is a female in her 20s who arrived asymptomatic from the area of concern, indirectly from from Wuhan, and came back into Canada on the 23rd of January, and then went to the community of London in Dr. Mackey's jurisdiction, and at that time she was asymptomatic. And during her time in her own location, she noted some symptoms and did the correct thing, and Dr. Mackey's here to answer details about that, and I'll ask him to speak in a moment. That throughout this process that she was seen, she was assessed and worked with the local health department, was admitted at the hospital under full protection of the staff and that, so no staff were put at risk throughout this process. And throughout this time, as you're going to hear from Dr. Mackey, protocols and procedures were followed excellently in such a way that there's been no risk at all to Ontarians or to the health system in this process. During this time, samples were submitted to the Public Health Laboratory at our one here in Ontario, and the testing had demonstrated it was negative, and she was part of our negative list on that one there. And part of what we're going to be talking about today is that in this evolving situation, our laboratory systems are moving quickly to keep upping the quality and assurance of the testing, and they're cross-referencing all the time, and Dr. Allen's here can answer some of those questions. So that during that time, with cross-referencing with even more specific and more different testing, different type and more specific one at the National Medical Microbiology Laboratory, they contacted our lab and said one of their tests came back as positive, weakly positive, and they had discussion on that basis there. And as med microbiologists do, they'll say, well, I think in this case, on a precautionary basis, we should switch this one from a negative to a positive, even though the level is very low, and the sense is that the viral load was very low as well. Nevertheless, to be thorough and precautionary, this one should be switched to a positive case. So that differs from some of our other ones we've had. So then Dr. Mackey was notified, as was the person, and they continue to monitor the situation, and Dr. Mackey is here to give a little update on that as well, and I'll hand over to him in a second here. So as a result, we're doing our testing, and what you're going to hear is that in this rapidly evolving, because remember, we only started this whole process 2 weeks ago, and shows you how fast the system's moving, how different it was from SARS in that time. Our labs are really moving at a quick pace to continually up the aspects of their testing and comparing notes back and forth. And this shows you the value of a laboratory network in Canada, which is not only just ours and Winnipeg, but also we have our counterparts in British Columbia, as well as that in Quebec. And they are working back and forth to continue to ensure a quality lab system in response to this emerging infectious disease issue in Canada. So the majority of the cases that were previously considered negative have been confirmed as negative by the National Medical Laboratory. Only this one is the one so far that they had any question with, and I said it was just barely positive, but they agreed with our laboratory staff in Ontario that we should switch that from a negative to a positive case. So the risk continues to be very low for Ontarians in this regard, and in accordance with a new case in London, it's the same thing. And I'm going to ask Dr. Mackey to comment a bit on his assessment of the situation, how it's occurred, and because he's the local medical officer of health, as far as our protocol is concerned, it is his responsibility as that, along with his staff, to deal with any person under investigation and to monitor cases and to ensure adherence to reporting and proper protocols and to assess any concerns and issues that he might have had during this process. So I'll hand over things to you, Dr. Mackey.
Thank you, Dr. Williams. So we do have a case here where both the system worked well and also you had a patient who went above and beyond to protect the public and the people she was in contact with. This is somebody who actually wore the equivalent of surgical mask for her entire travel from Wuhan to London, even though she didn't have symptoms at the time. She also went, because of her awareness of the risks associated with travel to Wuhan, she went straight into isolation in her home when she returned home. The only time she's been out of her home since then is to hospital for testing, and again, wore the equivalent of a surgical mask to protect others. In the hospital is well aware of how to handle this sort of situation, took all precautions to protect their patients, their visitors, and their staff. The patient has been and continues to be in isolation. There are other disease factors here which are very encouraging as well. First of all, the illness was very mild. Recovery was quick. Within 2 or 3 days, she was fully recovered. And also the lab parameters indicating that there was very low levels of virus in the sample. So every time she had contact with somebody in Canada, she was wearing a mask. Her disease parameters are quite low, and the system took all precautions when she was in contact with the hospital.
Thank you, Dr. Mackey. And so with that, that's why we wanted to make you aware of that and the aspects of why this one was considered a positive and why it's different than some of our others in that regard. And so we're here to then answer questions that you would have in regards to this now third case of a positive novel coronavirus here in Ontario, noting that the risk, again, as you heard, to Ontarians remains low. But we want to be forthright and make sure you're aware of that.
Dr. Williams, can you expand on how it can be that someone can test negative for this and then it later turns out to be a positive result?
That's why we brought Dr. Allen here, and I'm just saying that in this testing aspect here, as all our labs are working at raising the the sensitivity in different aspects, it's a dynamic discussion, as we're saying. But during that time, there's been no compromise in the positive cases. So I'm going to ask Dr. Allen if you can comment on what does that mean and how does this dynamic process work?
Thank you very much, Dr. Williams, and thank you for the question. So we really had the sequence for the virus on January the 10th, and the Canadian lab system has been working together to get very rapid, reliable tests. The test on this individual was done a week ago, and at the time, that was the very best test. It was the original test that we had all been working on collectively. And we continue to work together to get the very best test. So the original test was done well, it was done properly, it was appropriate. And then the second test was then laid on several days later, 4 or 5 days later, and we all have new tests that we've run it against, and it's picking it up. So this is part of the science of the way that we develop rapid tests for a response to a new pathogen that we're just learning more about, and really working lockstep together as a national laboratory system to make sure that we get the best test at any given time, that we continue to work together to get the best test, and that we continue to work to improve that.
Does that mean that if people test negative, that they could then be carrying this and not aware?
Okay, let's how we've done with those ones that we have tested negative and how you continue to reassess that and to affirm the status.
So we are continuing to run all of those samples on the newer test, both at Public Health Ontario and at the National Lab. And we are concurrently having conversations with other laboratories across the country to make sure that the tests are the very best tests that we can provide. So these are all being run in parallel as we speak, but the methodology, as one can understand with a very new virus, is one that rapidly advances, and that's what we're here to do, is to rapidly advance the test.
Elaborate a little bit more on the criteria, what you're looking at in this second test that might be a little bit different from the first that would deem it a positive result?
Yes, so we are currently at Public Health Ontario using 2 tests, and the National Microbiology Lab applied several days later 5 tests to this sample, which we are currently in the process of implementing. And so really it's about moving that field forward together. They actually look at slightly different parts of the virus and making sure that it's there, and it wasn't positive on all of their tests. So again, validating that we're really trying to move together to get the best answers for individuals and their diagnosis.
Anybody else in the household? You mentioned it was self-isolation immediately, where you mentioned went above and beyond. She went directly home, stayed home. Is there anybody else in the household?
So there is a roommate who moved out shortly after returning home. There was no contact with the roommate at that time. The individual also has an intimate partner, and they have actually worn masks in all of their contact since she returned home to Canada.
And so just to confirm, everyone who has been confirmed negative so far, are they being retested?
So they already have been retested at Public Health Ontario on a more sensitive test, and they are all negative, and they are in the process of completing they have almost completed all of them at the National Lab as we speak, and they're all negative.
This would have been on a separate flight as well from the others?
That's right.
Yeah, lots of different flights.
And is all the tracking and tracing going on?
Because and I'll let Dr. Yaffe answer that. As Dr. Mackey and I said at the outset, the person was asymptomatic, even back in Canada. So that flight, and Dr. Yaffe may want to comment on the need for any concern about that flight or the knowledge of that flight.
The bottom line is she was completely asymptomatic on the flight, plus wearing a mask on top of it. So there's no risk to the other passengers on the flights from her.
But
so there's no need to follow up.
Doctor, haven't there been in medical reports regarding possible transferring of this by asymptomatic patients? Like there was a case in Germany, for instance, where there was a suspected person who did not show symptoms and another person got the virus. So what does this tell us about asymptomatic patients and the possibility that they could potentially pass this on?
We've had discussions there's various reports coming in. Even with the German report, there's more investigation, and it may not have been asymptomatic. So they continue to look and review those materials. So far as the WHO and from also Dr. Teresa Tam, their assessment of the situation is the information supporting that is still very weak. Nevertheless, we'll keep looking and try to address it so that we keep to assess the quality of the studies and the information to try and understand that. But so far, their review of the matter is, and from the other experts in our network, remains weak information, but we still want to see what it is and be aware and assess that with quality information.
You've also got 2 additional factors in this case, right? The case was wearing a mask, which is exactly what you would want even somebody with symptoms to be doing. Second, the viral level was very low. Wasn't even detected with a standard PCR test. PCR tests are excellent, and the fact that it wasn't picked up on that test means, it's very likely that the patient wasn't even infectious at the height of her illness.
So if someone's viral load is low and they have no symptoms, can they in any way pass on that virus that you're aware of?
I think that is the question that Dr. Williams was talking about. The evidence, we're just learning more about this. It's a new virus. There have been some reports. Some of the reports, when they looked in the detail, the person who was supposedly asymptomatic actually had some mild symptoms when they were re-interviewed. So they were early in their illness. They were symptomatic. So we're still learning, but at this point, a Public Health Agency of Canada, WHO, are saying that at this point we don't have hard evidence of infectivity of an asymptomatic person. And
you remember we said yesterday also that the cases we see are very close family connections, person to person, and that term "they are not" is deemed to be quite low. So they're still trying to understand that, but it doesn't seem to be as widely transmitted at this time. But certainly, person to person within family contacts has been evidence, as in the case we had here and the Chicago case as well, and of course back in China.
Dr. Mackey, just to be clear, is the person... Oh, sorry. Sorry, go ahead. No, please.
Can you speak to why wearing a mask in this case was helpful? I understand it's not for everyone, and what's the difference?
The difference is whether you are sick or not. If you are sick, wearing a mask helps stop the spread of your infection. This is why anyone who's involved in a surgery is wearing a surgical mask so that they don't contaminate the surgical field. Whereas if you're not sick and you're just walking through the community, and also, potentially not trained on how to use a mask properly, not donning and doffing, taking it on, putting it on and taking it off properly, these are all opportunities for contamination. So wearing a mask when you're not ill in the community doesn't make a big difference.
And is just so I'm clear, is the patient still in home isolation, or she went still in hospital? Can you just clarify that really quickly? So
the patient is in home isolation. She's perfectly well now. She's been well for several days, but she has continued to be in isolation. Yeah.
Just to go back to Colin's question really quickly, so those 17 cases that you talked about, have they been, I guess, would you categorize them as just still negative or cleared? I mean, what's the simplest way, I guess, to
Yeah, we have absolutely no evidence that they're negative, and we're repeating all the tests. Most of that is complete. All of it is complete at Public Health Ontario, and the vast majority of it is complete at NML, so there is no evidence of infection.
Can we talk about whether what?
No, it's okay. After.
I was just going to ask, airlines, flight numbers, and hospital. How long was she in hospital? Which hospital was it? And what were the flights?
The individual was at University Hospital in London. This person is a student at Western University, but was not on campus. Still has not been since returning from China. The flight information will not be released at this time.
Because it wasn't important, as Dr. Yaffe said.
Will this person have to remain in isolation if she has such a low reading, I guess is the way to say it?
So, as Dr. Yaffe answered that, right now we're going through our protocols because now we have cases. And what is our guidelines for releasing someone from isolation? And so I'll ask Dr. Yaffe to talk to that.
Thank you very much. At the moment, our criteria are that the person has to have 2 negative tests at least 24 hours apart before we would release them. But there's a lot of work going on to figure out what is really the best way to determine when they can be discharged from measures. But at this moment, until anything changes, those are the criteria.
Dr. Mackey, can you tell us the timeline from when she landed to when she started experiencing symptoms to when she went to hospital?
For sure. So she left Wuhan on January 22nd, arrived in Canada midday on the 23rd. It was the next morning, the morning of the 24th, that she developed symptoms.
And went to hospital on the 24th?
That's right. She went to hospital on the 24th. She was not admitted, not ill enough to be admitted in hospital. They simply swabbed and in concert with public health, sent her home for monitoring there.
With this case and the patient that was just discharged from Sunnybrook Hospital, and maybe Dr. Williams, this is a question for you. Are you considering this improvement for her in London and what we just saw at Sunnybrook? I mean, do you think that this is the public messaging here that the system's working? I mean, do you think that they should take the fact that people are self-assessing and they're being brought into the hospital and now they're being discharged and they're in home isolation? I mean, is this kind of a message to the public that the system is working? Do you think this is an opportunity for you to temper down any concerns? Or
most definitely. I think that gives evidence of it. And not only is the system working, as we're doing with this case here, we're double checking on a number of things because we want to not only ensure it's working well, but we want to even do further steps on a precautionary basis to make and to assure ourselves even further. So we're just not coasting on that. We continue to reassess, and that's part of our function, working with all our partners in the system, because that's the difference between now and SARS, that they are all up on the topic, they all understand it, and they're looking for anything that may be in their minds weaks or gaps in the system, raising those questions. And so we have a lot more monitoring, live time assessing of our systems, and that makes for a dynamic, very quality response system in Ontario.
Dr. Williams, I believe at a press conference last week you said you were a bit surprised that there were such a small amount of confirmed cases outside of China. And I'm just curious whether or not you feel or you're concerned whether the information that's coming out from Chinese officials is accurate.
No, I think I said what I was surprised is that the number reported in China was at that time so small, because I would expect it to be much higher. As I said, I expected it to be well over 10,000, and we're getting close to that now, because that's just in a large outbreak, that in a large population that had gone for a period of time, it takes a while for the testing infrastructure to get up in place, and they're just doing first the most severe, then they're going out wider and wider. And so as the Chinese officials do that, I was anticipating, and I was reassured that they're actually finding more and more of them tend to be ones with milder cases. And so we'll get a better epidemiological picture of how this virus impacts a population at large as the system is enhanced and building up. So we've seen that in our own way in other past ones. It takes a while to step up to that task. So I wouldn't say outside the country, I said in the country, especially in the Hubei province, in that area there. And so someone asked me, was I surprised it was going up quickly? I had anticipated it to probably go higher, and I will be not surprised it goes over 10,000 higher, because it is a big task, and they're undertaking that, I think, in a very aggressive and assertive way, and that is reassuring thus far to us here in Canada.
Are you confident in the numbers that are coming out from Chinese officials, that you believe that what they are distributing is accurate?
Our information from WHO on that, they're being very forthright on that information. I think the numbers, they're going to do a lot of catch-up, and that's what they're doing now. They're identifying ones that were cases maybe a week or so ago, so they're taking it through, and as Dr. Mackey has alluded with his clients, sometimes the younger ones may have a much shorter course, very mild, but with the testing, they'll come back positive. And so that only adds to the numbers, but it gives you a different spectrum, not just the severe cases that are in the hospital.
I'm doing a story about a concern from Toronto hospitals that their masks are going on backwater. There seems to be a lack of supply. They're concerned it could be a problem in the future. Part of the problem seems to be that people are taking them from hospitals. Is there anything that you can add about the supply of masks and what that might mean for Toronto hospitals?
We have meetings, regular ones, with our stakeholders, including our hospitals and that, and we're looking at ensuring that there is adequate supply, both of their current stock and then if there's something in a larger situation. So that's part of that feedback from the sector. If there's gaps in services, we'd like to know, and if there's some evolving new situations, we haven't heard that one in particular, but that's something they would report back to us, and then, of course, that's something they're going to have to deal with internal systems that the hospital is responsible for to maintain their existing stock and to handle it judiciously according to policy and procedures of our infection prevention and control practices. So it's one that's part of the dynamic, and I haven't had that reported directly, but it doesn't mean it won't be, and we will be in concert and discussion ongoing with our healthcare providers.
Dr. Williams, I know previously we've heard that there were individuals who were perhaps vulnerable, had pre-existing medical conditions, might have been a little bit older, but in this case, we're hearing about someone in their 20s. To you, what does that say about the transmissiveness of this virus?
Well, it tells us that, as we said before, in the area of exposure in Wuhan, where this person came from, the amount of contacts you come in with, especially because you didn't know who had it and who didn't, and you have many close family contacts. And I think as the government officials are going to find, there's going to be a lot of young people who had, as we find, some people said, I don't think I was sick. I guess I was. I had a cough or something for a couple of days, and I felt like a cold, and they get tested positive, and that may happen. So some younger people have a more robust immune system, and as Dr. Mackey said in this case, the person turned it around very quickly as compared to our first case, which took a bit longer and is still recovering. So I think you see as a spectrum of how the virus is impacting the population. So it's not the same across the board, and when people start initially talking about transmissibility rates and case fatality and that kind of stuff with a very small sample, that can be misleading, and we're saying, it's early days. Let's see how the wider population is impacted, and we're learning more as we speak. And so this one here gives an example of a different spectrum presentation than our first case.
I think one thing that this case really points out is that you are part of the system. You know, the healthcare system is doing as well as we can in Ontario, but it's also really important for people who are ill and have been to a place where the virus is spreading to isolate themselves and call public health. The people in the community can be a really important part of the system in preventing the spread of coronavirus.
WHO yesterday declared a global emergency. I'm wondering how that changes Ontario's response or alters it in any way.
So talking with the Chief Public Health Officer of Canada on that, who was at the WHO table, the understanding is that when they declared a emergency of a public health level on a global basis, the main purpose was to ask the system writ large to look at their preparedness for their different aspects in dealing with it, as in what is your surveillance capacity, what is your response capacity, what is your infrastructure, what is your laboratory testing. Of course, Ontario is, in Canada, is we have no problems with that. We're not, it's not named at us. It's so they can do an inventory of some other countries in that where if it did go to those ones, the infrastructure to deal with a proper response, like we're doing here, may not be there. So the WHO has to address that and saying, what are we going to do about that? Especially if they've already identified 1 or 2 cases that have moved out into that area. Then you have to look at infrastructure investment, and so that the WHO is assured that the globe is ready to deal with it if it were to go to spread to their other countries. Dr. Tam feels, and we know, that Canada is well prepared. We're not one of the concerns, so it doesn't impact us at all. But it's more that wider inventory on a global perspective.
How would you describe the province right now? Is it a heightened state of alert? Is it at the highest level since SARS? How would you describe our level of alert?
I would say our system is on active monitoring and containment type process, monitoring the people coming in as we're doing now. It's not widely spread in the area. We have no transmission occurring in Canada and Ontario, so we're not on the highest at all. But we're not telling everybody be casual, follow the guidelines, adhere, as Dr. Mackey said, individuals returning, do the right thing in the right way at the right time. We have all those in place, the education things going out to the public. And so with that kind of assertion activity, it's not an apprehensive state. It's one of being aware, knowledgeable, and doing what you need to do when you need to do it. And I'm happy to say, as you can here, our system is doing what it's supposed to do. The public and those returning are doing what they're supposed to do, and that's very reassuring. And so we're not in a heightened level, but everybody is aware and becoming more knowledgeable. And I think the public discourse is that they're becoming more informed on a personal basis, and we as a population on that. So that's our challenge right now, to make sure we maintain our public education and they're aware of what the status is, so that a response on a personal basis, community basis, is reasonable, sensitive, polite, and yet knowledgeable.
Do you know how many flights we're getting from China every day now? Like how many there were a week or so ago, and now that our airlines are scaling back flights, do you know how many it's been reduced to?
I don't have that offhand, but I'm aware that some of the airlines have stopped some of their flights, and we were asking, as you asked, someone asked yesterday, do I know the reason? I haven't been briefed and told by those carriers why they're doing that. It may be, yeah, but I'm not pretending to know that.
In terms of this compared to the regular flu, a lot of people go around their daily lives not worried about the regular flu. Is this that much different?
At this moment, it seems to be paralleling that. No, of course, people have not been exposed to this novel virus before. Some of the flu ones, there's some cross-reactivity at times. I wish people were as sensitive and concerned, but Ontarians I've seen are pretty good about it. Still going to get vaccinated. We still like more to go and get vaccinated, especially the younger adults and the children, and making sure the pregnant women are done. So we haven't given up on reinforcing that message. We still push every year on...
In terms of the novel virus, though, young and healthy versus people with compromised immune systems, it appears this fourth case bounced back very quickly. In terms of recovery, is it similar to the flu?
Too early to say. It seems to be, as we've seen the impact and in China, it may be premature to say it's milder than influenza A. Influenza is still a very severe illness in people, even in young people, and it's more than just a few days, couple of days. It can really be quite debilitating for some young people to get it, so it's not to be taken casually. Is it comparable? Early to say. Some of the things we're seeing, and that's why I was looking for the population health data from the Wuhan Hubei district to say on a population-wide, what is the spectrum of disease in your whole population, just not in your vulnerable ones. And of course, it's the vulnerable ones that showed up first at the hospitals, severe illness and that, and they focused on that. And as they do more and more testing, we'll get a better picture, just as you're inferring, of what's its impact on younger people, healthier people. Does it mimic our case here? It may be. R1 is not a good one to sample and make a presumption on. But I think that's what we might see, but early days.
Dr. Williams, you made a comment earlier about how this is different than SARS in the way that the illness kind of, or the virus comes to light or exposes itself differently in different people. Can you expand on that a bit more? Is it less predictable? You made a comment early in the press conference about how it kind of...
I was talking about more the system and the system's preparedness for it. The fact in the SARS one, we were well through and we didn't even know what the organism was. We had no laboratory testing methodology. The system was not alerted, not aware. The infection prevention control practices were not as sophisticated, anywhere near the sophistication they are today. So I was more talking about the system preparedness, not comparing one organism to the other in that. And so if I gave that inference, that's not what I meant.
And just to follow up on the question about the flight information, can you explain why that you're not revealing the flight number and information?
As Dr. Yaffe said, because the person we have many flights during this time came in, because they said there's a number every day with 2,000 to 4,000 people coming back from China. We're worried about the ones that were someone who was symptomatic on the flight, and then we have a protocol of how to follow with the individuals around that person. That's laid out with science and understand evidence. This person was not asymptomatic, therefore we're really not at this time. We have no need to know about the flight officially because we're not going to do any manifests. We're not going to check it out because we have no evidence that anyone's been put at risk. If there was someone, then we would look at it, as we did in our case, who we felt was symptomatic while on the flight. Then we're following up with that one appropriately. So all the 20, maybe in this time period, 50, 40, 60 flights, we need to know that there was someone on the flight that was symptomatic. We need to know the details of that. Then we need to know where they are in the flight and all that kind of stuff as the protocol we're undertaking with our first case.
But doesn't this case prove that you can be asymptomatic and still carry the virus?
No. Because the person might be incubating but not transmitting. Our evidence from the WHO on that is that people during the incubation period are not transmitting. Once it becomes symptomatic, they're showing evidence. We have not seen asymptomatic, as we talked about, remember, first question, the evidence is not strong enough for that indicates, and we haven't seen that evidence itself in that light. So if that changes, we'll have to be informed of that. But so far, quite a bit along, we have not seen that being strongly evidenced in the cases presented.
And Dr. As you mentioned that because she came from Wuhan, and who knows how many contacts there would have been. I mean, you don't have any suggestion about exactly who she may have gotten it from or how she got it, because there's just too many. Maybe perhaps Dr. Mackey, that's perhaps a question for you to take.
Yes. So this individual had two parents who were both ill in Wuhan. They were both in hospital, but their illness was deemed to be mild. And in terms of triage,
with corona?
I'll just finish.
Oh, sorry.
Their illness was deemed to be mild, so they weren't tested. So, I mean, that's one of the reasons why she was particularly alert to the issues. But just to add onto the question around the flights, the message to somebody who's been on this flight is no different from the message to someone who's been on another flight from Wuhan. You should be watching your symptoms. You should be staying home if you're ill and contacting public health right away. And we would not change anything we're doing with anyone who's been on this flight compared to someone else who had been on a flight from Wuhan.
Dr. Williams?
And this flight we have no flights from Wuhan directly into Toronto. They're all indirect, just to be clear.
What's the advice and information that's being sent to general physicians who on a daily basis are seeing patients come in with coughs, respiratory illnesses, or fevers, and aren't quite sure whether or not these individuals need to go to a hospital for testing? There's that kind of bit of a gray area there. What's the advice?
I'm going to ask Dr. Yaffe to answer that question, and then if Dr. Mackey wants to follow
sure.
up how he did it.
We have, the ministry has sent out some guidance to primary care practitioners, and we're recommending that they put up some signage, and if the patient has been in Wuhan within 14 days and has symptoms, we're encouraging that they call first to give the travel history. Or if they show up, then at least the physician and their staff can put on masks. And if testing is required, they would have to have fit-tested N95 masks or send them to another facility under proper precautions to get tested. So the information has gone out to primary care. We do get questions, and it's as the information changes or evolves, we'll be keeping them up to date.
At the end of the day, just, you know, to avoid putting strain on the healthcare system with people showing up at the hospitals who just, quite frankly, don't need to be there. That's kind of what my concern is how are these general physicians, how do they exactly know which case is symptomatic?
Well, yeah.
Part of that
Go
is
ahead.
that local public health is there across the province as a resource. Anytime primary care needs advice on who should go to hospital, who shouldn't, who should go home, and how to manage them, we're there for them.
Dr. Mackey, did you say that this patient's parents were in hospital with symptoms, but they were deemed too mild a case to be tested for coronavirus?
That's right.
Does that
In
not
Wuhan.
In Wuhan, does that not suggest, though, that perhaps they're not as vigilant in testing for this virus as one would think they would be?
What-
Because here a case has spread to Ontario, where the parents had symptoms.
So you wouldn't have done anything different with this individual. She was well. She still would have traveled. But I mean, I think as Dr. Williams alluded to earlier, it's clear that the system in China is working at capacity. And so they are, there will be time before we know what the full extent of the case count is. And if you look at confirmed cases versus suspect cases, that's a great example. Not all of those suspect cases will even be tested because of the limitations in testing resources and the number of people ill.
So if they're in the hospital today, my guess the Chinese government would have tested them. But early on, as Dr. Mack said, they're just ramping up. They're dealing only with the most severe cases. They assume that mild wasn't. Novel corona perhaps is only a severe case, but as they find more mild, and they get their capacity up, I think they'll be do far and wider and more at ease testing. And that's just part of what the reality is when you're ramping up a system under a stress situation.
Dr. Do you know how the parents ended up in hospital if they were mild? In Ontario, you're not going to get into hospital with a mild, respiratory bout. So how did they end up in a hospital in China where the hospitals are supposedly jammed with people?
Again, this is weeks ago at this point. I don't have further details, unfortunately.
So Dr. Williams, what concerns do you guys have about people who may have traveled from Wuhan to Toronto, may have a low viral load, may be asymptomatic and may be kind of in the community without the awareness that they should have been self-isolated? Because clearly there is a case now of somebody who met all of those criteria, but there may be other people who may have arrived and not really know and may not be taking those precautions. What concerns do you have that there may be people out there like that? And could they spread the virus?
And it's a good question, and that's why we've been saying all along, we've seen that the returning travelers have been very responsible in that regard. We haven't seen cases all of a sudden show up and they didn't tell anything. If they were, and we're getting this illness and showing up in our emergency departments, and a physician would elicit that kind of information and test them and say, well, this one didn't follow the normal process at all. As of yet, we haven't seen that. Doesn't mean we won't pick it up if we did, but so far it's been very responsibly handled, and we haven't identified any of those. But again, we're being vigilant. We're looking for those cases. Primary care doctors detecting if they think there's concerns that someone has a travel history and of some questionable level, they can still feel suspicious enough and saying, I think we'll get some testing done, and send the requisition to public health laboratory along with other tests because they're wondering what is the diagnosis here. So with that sensitivity and that alerted awareness, we haven't seen any yet. Is that reassuring? Does that mean we are not going to be vigilant? We still have to be.
Oh, sorry, and Dr. Mackey, the woman in her 20s, did she eventually exhibit any symptoms?
Yes, so she was symptomatic. She arrived in Canada midday on the 22nd. She was symptomatic the next morning. So that's when she went to hospital, got tested, and went home into isolation.
Has she stayed at home since then?
Yes, she stayed at home except for another trip to the hospital to get tested, again with all precautions.
Dr. Williams, just at last glance, what was the number of patients now who are being monitored and the total number at this point of patients who have been tested in the province of Ontario?
Well, we gave the numbers out this morning at 10:30, and so we're those are the ones we have at the moment. As you notice, that doesn't have the new confirmed case in it, so this is hot off the press for you to know. And so we're going to redo those numbers, and so we got some new stuff coming in, more results coming back from both from public health lab, as well as new cases coming in, new PUIs, person under investigation, and the national medical lab thing. So once we bring that data in, we rectify the records and get the collated up, and that's our process in the future as these are getting more, that we then give you the new numbers tomorrow again, because whatever we give you within an hour or two, it's no longer up to date. And so we'd rather say, as of this time each day, here's the numbers. And so we haven't changed the 10:30. We'll change them again 10:30 tomorrow.
So the woman in this case is just moved from a person under investigation to confirmed case?
From a negative to a confirmed case.
Question. And well, Dr. Yavi, just to touch back in terms of how long she'll have to stay in isolation. You said it's 2 negative tests 24 hours apart, and that's when I guess you go from positive to clinical. Just really quickly go over that in a nutshell.
At the moment, that is the criteria we're using. Two negatives, at least 24 hours apart.
Are you looking at any other tests right now that are kind of flirting with being a positive result?
There is none to my awareness, but testing is ongoing day and night, and so these results are really brought to you as soon as we have them.
Dr. Allen, can you, in the most simplest terms, take us through your testing? So when you guys get a swab, I'm guessing?
Yes.
Just take us through that process in the easiest way possible.
Thank you. So first we get a phone call at the lab, usually in concert with the local public health unit, and we request that they take 2 samples, a throat sample and a nasopharyngeal sample. And the reason we do that is to maximize the possibility of finding any potential virus there. We then run it on several tests. One is a test just for other viruses. Right now we're in flu season, so to make sure it's not flu or something else more common that's in the community. And then we concurrently run a PCR. The PCR then runs, it takes 6 hours to perform, and then we basically do an additional test if it looks like there's any RNA that's on the result of the PCR, and we spell that out. So we do a very clear confirmatory test if there is any possible virus there. And so it's a little bit longer of a test, and some of these new tests are going to be much faster, and so we've concurrently been developing with our partners much more rapid tests, which also have some of them may be a little bit more sensitive, but we're running them all in parallel. PCR is looking for the genetic barcode of the virus.
Okay, thanks everyone. I finally have hard copies of the news release, which is John Hodgman. If anyone wants a hard copy though, happy to hand it out.
Thank you.
Good morning, everyone, and thank you for attending today. My name is Bancroft